October is Breast Cancer Awareness Month, and UI Health is where innovation meets equity.
The Breast Cancer Care Center is focused on making sure those innovations match the needs of patients and are accessible to everyone in our community. Dr. V.K. Gowdy joins us with more. Thank you so much for being here. First of all, let's set the guidelines right away, because I know they've changed when women should have their baseline, their first mammogram. Is it 40 now?
Yeah, it's still 40. We want women to come in at least get an initial evaluation with a mammogram around then. And then we might space them out every 1 to 2 years, depending on the patient's risk, characteristics, family history, other factors like that.
So one thing we've been talking about is that when I get the mammogram result back, and a lot of my friends, a lot of people I know, it says dense breast tissue, go for more. Do we have to go for more testing, or?
That's a
Well,
great
let's
question.
clarify what dense breast means, for example. So dense breast poses two challenges. So the mammogram just gets harder to read when there's a dense breast, and it looks like you're looking for a snowball in a snowstorm. That's how it's described. So it makes it harder. And then independent of that, having dense breast is associated with making cancers easier to develop. So it's two challenges. And so we do recommend people go get additional modalities for screening. So if the mammogram is this good, maybe if we add just something else on top of that, we'll do a better job of finding cancers. Oftentimes it might be something like an MRI or a whole breast ultrasound, but that's a conversation you can have with your provider.
What should women know ahead of getting a mammogram?
Well, be prepared to know that most women won't have a cancer when they go in, right? But these scans sometimes can show things that they have to follow up on, and you have to take your temperature for a second, your heartbeat for a second, and say, okay, it's going to be okay, kind of go with the flow. And ultimately, if a cancer's found, remember, it was found as an early stage process, something that's more likely to be cured than anything else. And so just kind of go with the flow and try to, accept the information as it's coming at you and, think through the process.
And that's something at UI Health that you guys sit down with the patient, you talk to them, you go over everything with them so that they really understand what this means.
Yeah, we actually have taken a kind of a nice approach of using navigators, for example. We help essentially give you a buddy through the process from that first mammogram that shows something might be going on to make sure that each appointment happens, that it's happening in a logical manner. And if a cancer is found, that care is also coordinated. It's something that we found makes a big difference for patients who are having a hard time understanding what's going on.
How is UI Health advancing new innovations?
So across the spectrum, whether that's from the initial diagnosis and how we're doing in finding those cancers to how we analyze the tissues, but also how we bring the doctors together who do something about the cancer. What's the most modern surgical techniques, or can we spare you of this really horrible surgery for something more precise? In terms of radiation therapy, can we more precisely target the tissues that need to see the radiation so that we don't harm the rest of the body? And then lastly, I'm a medical oncologist. We were joking, I give poison for a living, but we want to be able to judiciously use those so that we don't harm people and kind of maximize the benefit. There's innovation in every one of those components.
And as far as just even assessing risk, I mean, we've heard so much about the BRCA gene and what can be done. Is that something you guys review too, that if you want to take preemptive steps, it's there?
Yeah, absolutely. We have one of the first of its kind family health screening programs where if you come in and we identify that you have one of these genes that's making it easier for your body to make cancer, not only do we manage that cancer with precision medicines and approaches, we can also then look at the entire family to make sure we don't miss somebody else and make sure we cut something off at the pass before it becomes an actual cancer. Wow. So really a lot of prevention is possible as a result of the way we've set up our screening programs.
That's interesting.
Dr. Gowdy, it's great to have you here. Such an important month. And get your screenings.
Yes.
For more information, you can scan the QR code on your screen. You can also head to breast.uihealth.care. Find them on the socials. First step is just getting seen, right?
Absolutely.
Beautiful. Excellent. Thank you so much.